And a very warm welcome to you to today's seminar and presented by Ash. The purpose of the webinar is to reflect on the major progress that we made recently over tobacco control, which in the last year has moved on significantly. So it's great to see we've already got 73 people online, but we're going to be joined by, we expect, 150 who have registered for the session today. The first update will be the new report from Ash and Cancer Research looking at the state of local stop smoking services and wider tobacco control. The report is based on the annual Ash survey of local authority tobacco control activity, which has run for 11 years. And the 2024 report explores how new funding for tobacco control is being used by local authorities to increase their offer to people who smoke and reach communities where smoking prevalence, unfortunately, remains high. Now, alongside an update on the report findings, the webinar will also include case studies from areas including innovative approach to support smokers to quit, give an overview on existing resources to support those working in tobacco control, and set out some priorities in using the additional funding for stop smoking services. A few words of housekeeping. This meeting is being recorded and it will be uploaded to the Ash website and shared with attendees along with the slides. So can I ask that all panelists and attendees keep themselves muted and turn their videos off unless they are actually presenting. If you fail on that, then the Ash staff, I'm sure, will be muting you and unmuting you accordingly. So we encourage all of you to submit questions and reflections in the meeting chat. So we will get round to asking questions towards the end of the meeting. And if there's any other issues, then do please either use the meeting chat or email admin@smokefreeaction.org.uk. Right, a little bit of background then, reflecting on this moment of opportunity created by the Tobacco and Vapes Bill, the new funding for tobacco control and the shift to prevention in the NHS. This seems to be a moment where the sands are shifting and the momentum is with us. The contribution of local government is making to integrated care health as well means that we have a substantial voice within the NHS, and public health already ensures that smokers get the support they need. We just need to make sure that public health gets the funding that it needs. So while smoking rates are declining, health inequalities remain stubbornly high. The work being done by local public health to support people from the most disadvantaged communities to quit smoking is vital for reducing inequalities and achieving the national ambition to halve the gap in life expectancy between richest and poorest areas. We'll reflect on the role played by the elected members in ensuring tobacco control is local priority and supporting national activity advocating for tobacco and vapes bill. So I'm delighted to be joined this morning by a number of key speakers, by Will Anderson, who is a report author, John Waldron, who will talk to us about the key resources, and John, of course, is Policy and Public Affairs Manager at Ash. Margaret Jones, Director of Public Health at Sefton Metropolitan Borough Council. Kaye Mann from West Yorkshire Tobacco Control. Sophia Papadakis from the Academy and Health System Consultant at Smoking Cessation and Training. And last but not least, Alison Challenger, Director of Public Health for West Sussex County Council. A whole range of real experts to talk to you this morning. So without further ado, let me hand over to Will Anderson, who is report author, the update on the new Ash report, expansion and renewal of local authority stop smoking services and wider tobacco control. Over to you, Will.
Thank you, David. Good morning, everyone. As David said, I'm reporting on the annual survey of local authorities, their stop smoking services and wider tobacco control work. And this is conducted by Ash and Cancer Research UK. Next. So this survey was conducted in August and September. We had an 81% response rate. We always get a good response rate. Thank you to all our respondents out there. We do appreciate all your input. We've been conducting this service every year since 2014, which was the year after public health and tobacco control moved from primary care trusts to local authorities. And I'm happy to say that I think this year we've probably got the most upbeat and optimistic results across the entire period. So next, some headlines. The priority of tobacco control in local authorities has risen to its highest recorded level. For the first time in 10 years, all surveyed local authorities commissioned a stop smoking services, and there is a huge expansion of stop smoking services underway. despite significant obstacles. Year-on-year demand for stop smoking services increased in 48% of the local authorities, and not least, by any means, local authorities continue to engage in a wide range of tobacco control work, tackling the illicit trade, promoting smoke-free homes and public spaces, public communication. Okay, moving on. So the priority of tobacco control was perceived to be a high or above average priority in 88% of surveyed local authorities, and a high priority in over half, 54%. And it was more often perceived to be a high priority than any of the other public health issues we explored: alcohol, drugs, obesity, sexual health, gambling. Next. This is just an indication of where we've come from. So in 2021, only 18% of our respondents felt that tobacco control was a high priority in local government. You can see it increased significantly in 2022, but now it's really kicked up again in 2024 to reach, as I've said, the highest level in 11 years. We've been asking the same question about the priority of tobacco control for 11 years, and 54% is easily the highest level we've ever reached. And of course, this is in not totally, but in some considerable part due to the national policy announcements last year. Next. The smoke-free generation news and the media attention it garnered seemed to get the conversation about smoking started once again. Members seem invested in ending smoking and supportive of the work taking place to do this. Smoking has risen in importance since the Smokefree Generation programme has started. We have re-established the Tobacco Alliance and produced a tobacco control action plan. And indeed, the number of local authorities reporting they now had a tobacco control alliance has gone up. Next. Just looking at the alliances and partnerships, so 70% of local authorities this year said they had a tobacco control alliance. That's up 10 percentage points on last year and up from 54% in 2021. And in all regions, there were regional and sub-regional partnerships, although of course the extent of investment in those partnerships varies a lot across the regions. And integrated care systems have also enabled new alliances in many areas, especially in the delivery of integrated stop smoking support. Moving on. So stop smoking services, as I say, all local authorities commissioned one in 2024 for the first time in a long time. And 89% commissioned a specialist service. And that's up 17 percentage points from last year. That's a big change. Year-on-year demand for stop smoking services increased in 48% of local authorities and decreased in 6%. And that's on top of last year, when 36% of local authorities reported an increase and 8% reported a decrease. So we're seeing a steady rise in demand. Community stop smoking services run by local authorities were well or fairly well integrated with NHS tobacco dependence treatment services in just over half of local authorities. So still some work to do there. Moving on. So the £70 million funding announced last year, we asked an open question about what was being done with this funding. And this list is derived from the quite detailed answers that our respondents provided. But you'll notice that this list is also quite similar, not surprisingly, to the guidance. So the funding is being used to increase capacity, to increase the range of settings where support is offered, to improve referral pathways, to increase wider workforce skills, to target communities most in need, to promote stop smoking services, and to strengthen the system. We also asked an open question, about the obstacles that local authorities were facing in making the most of this £70 million funding. Next. So the barriers were the tight timescale for delivery in year one, the lack of guaranteed funding after year one, the time required for governance and procurement and the constraints of the PSR regs, recruitment challenges, restrictive criteria and targets, and limited capacity, both in local government and in partner organisations. A couple of quotes, moving on. Next. The short-term nature of the funding means that any new posts created are insecure. Additionally, there is a limited pool of trained and experienced staff, and the short-term nature of the funding does not allow time for developing competence in the workforce. We've been told that the funding will be available for 5 years, but reviewed after each year, which makes planning longer term more difficult. For example, the contracts for the new posts were advertised as 18 months, with the council covering the additional 6 months if the government grant is not extended. Ideally, the funding will continue and we'll be able to extend the contracts for the posts, but we won't be able to give the practitioners any reassurances about that until we know what the government decides. Next. Tackling inequalities. Curiously, this wasn't really a feature of the guidance on using the new funding, but it was a major feature of our respondents' accounts of what they're doing with the money. The top 4 target groups for stop smoking services identified by our respondents, and it's a very long list altogether, were areas of deprivation, people with mental health conditions, people in routine or manual occupations, and still up there, pregnant women. And tackling inequalities was also a key focus for Swap to Stop. Next. And that was, so 93% of local authorities were participating in Swap to Stop. And the top 4 target groups that had benefited most to date from the scheme were pregnant women, people with mental health conditions, users of substance misuse services, and deprived communities. And the top 3 problems reported were concerns about the health impact of vapes among both users and among kind of professional partners, lack of engagement or capacity in partner organizations, and delays and supply problems. Next. So I'm only kind of touching on this lightly here, but needless to say, there's a great deal of wider tobacco control work being undertaken, enforcing legislation, tackling the illicit trade, promoting smoke-free homes and smoke-free public places, working with children and young people, and public communication campaigns on smoking and vaping. And a great deal of this, of course, is taken in partnership at regional and sub-regional level. And there's a lot of detail about what people are actually doing in the report, as there is about everything I've covered. So I would encourage you to have a look at the report. You know, we appreciate the level of detail that our respondents give us about what they're actually doing out there, and we've tried to reflect that in the report by including a lot of quotes, so you can see the extraordinary diversity of what's actually happening on the ground. Okay, some conclusions. Next. Local authorities in England have never been more confident about their role in reducing smoking and improving the health of those affected by smoking. The new funding announced in 2023 has given a major boost to the development of stop smoking services. Despite major challenges over the last 10 years, including reductions in the public health grant and, of course, COVID, most local authorities were in a strong position to respond creatively to the government announcement in 2023. Uncertainty about funding remains a key obstacle to development. Thank you very much.
Well, thank you very much indeed. That certainly set us off well and given us some real insights into the report. I'm going to hand over now to John Waldron. John's going to talk to us about resources to support tobacco control. John.
Great. Thank you very much, David. And I've only got 5 minutes, so I'm going to be very brief. So yeah, as David said, I'm just going to give a really quick overview of some of the key resources to support tobacco control activity. So just starting with some of the ASH reports and guidance and materials developed by other partners as well. So as you can see here, there's several reports and briefings designed to support tobacco control activity. So these summarize the evidence in a kind of accessible way, include case studies, examples of best practice, and practical recommendations as well, because these are really designed to be as practical and useful for you in your day-to-day activity as possible. And these cover everything from implementing NICE guidance to training staff, engaging senior leadership, collaborating at a system regional level. There's a real range of resources there, so I would recommend having a look through those if you haven't already. Next slide. And so just touching on the local government declaration on tobacco control. Hopefully most of the people on the call are familiar with this. So this is a statement of a council's commitment to implementing kind of comprehensive tobacco control activity and ensuring that tobacco control and ending the harms from smoking is a core priority for the local authority. And that's been signed by over 120 local authorities since its inception back in 2013. And signing it is a real opportunity to secure internal support for tobacco control and put it on the agenda for your organisation. But then also once you've signed, it allows you to kind of build that momentum behind tobacco control activity and hold your council to account on implementing those recommendations. And there's a full list of signatories and supporting info at the link there. And if you aren't sure if your council signed or if you haven't signed, then now is a great time to sign or refresh that commitment. Next slide. So then just touching on Article 5.3, so that is the WHO FCTC kind of commitment to protect public health policy from the vested interests of the tobacco industry, and all local authorities should have a policy on limiting engagement with the tobacco industry. And if yours doesn't, or you aren't sure if it does, then it's worth going away and finding out if it does and developing or refreshing that policy to make sure that everyone in the local authority is aware of their kind of obligations under Article 5.3. And ASH has developed a toolkit to support local authorities to ensure it's implemented effectively with kind of guidance and resources. And the LGA has also developed guidance for those working in local government as well. And these resources can really be used kind of in a kind of complementary way. So I would definitely recommend looking at those. Next slide. And so we've produced a kind of a set of data tools and calculators to support local activity. And I'm sure most of you are familiar with the ASH Ready Reckoner. So this is a simple cost calculator that allows you to visualize the cost of smoking to society, to the NHS, to the economy, and to other areas as well. And this is broken down by region, local authority, combined authority, ICB, and parliamentary constituency as well. So a really helpful tool. And we've also got calculators looking at the economic and health inequalities, impact of smoking, and also a return on investment tool for the NHS tobacco dependence treatment services. And they're available at the link on the page there. Next slide, please. We also commission annual polling from YouGov on public support for a whole range of tobacco control measures, and you can see the graph there just showing the growth in support for activity to limit smoking on the side. And this data is broken down by nation, region, and parliamentary constituency as well. And so I would definitely recommend having a look at some of those links if you haven't seen them already. They're really valuable for kind of making the case both within local authorities, but then also more widely and when advocating to politicians to kind of encourage them to support tobacco control activity. This data showing really overwhelming public support is really valuable. Next slide, please. And I just wanted to touch on briefly the OHID smoking profiles and the smoking toolkit study. And I'm sure most of you will have seen the OHID smoking profiles. So these were formerly run by Public Health England, now run by OHID. And these give you information on tobacco use, harms, mortality, inequalities at a national, regional, local authority and ICB footprint. And that's really granular data and breaks down in a really, a really diverse set of ways. So you can really get into the detail there. And then there's also the smoking toolkit study, which probably isn't as widely, people aren't as widely aware of it, but it's a really useful resource. This is run by UCL. This is a kind of regular survey they run, and this gives you information on smoking prevalence in different groups over time, vaping prevalence, quitting motivation and behaviors, and it also has annual and monthly data. And I've just included a couple of screenshots at the side to kind of visualize what some of that data looks like. So it's worth having a look at their website if you haven't seen it before. And then next slide, please. And then finally, just looking at some of the NCSCT briefings and e-learning. That's the National Centre for Smoking Cessation and Training, and they provide briefings and e-learning and training on implementing NICE guidance on smoking. And this is really high quality evidence-based materials. And so I've just highlighted some of their briefings and materials there. So in particular, they've just updated their briefing on maximising the impact of stop smoking services, which brings together all the latest evidence and practice to support local tobacco control activity. And they also have a range of online training and e-learning covering things like VBA+, Swap to Stop, secondhand smoke, stop smoking medications and vaping, and they also have tailored modules for people working in different kind of settings and specialisms. So I'm sure most of you are familiar with the NCCT resources, but if you're not, it's worth having a look and refreshing yourself. And then on the next couple of slides, I've just included some useful links to various resources for you to look through when we share the slides afterwards. But that's it from me, keeping it short and sweet. Thank you very much.
Thank you, John. And you almost made it within your 5 minutes, but I'll give you the leeway of 6. But thank you anyway. Some really important information there. All that's available on the slides. It's going to come to you at the end, or it will be on the ASH website at the end. Please don't forget to post questions. We do need some questions for the questions and answers at the end. So put up any questions you particularly like to ask any of the panelists. I'm now going to hand over for a case study to Margaret Jones. Margaret is the Director of Public Health at Sefton Metropolitan Borough Council, but she's here speaking this morning on behalf of CHAMPS, Cheshire and Merseyside Public Health Collaborative, altogether Smoke-Free Programme, which is quite a short, snappy title there. So thank you indeed, Margaret. I'm going to hand over to you for you to tell us a little more about the project.
Thank you. Well, it's lovely to be here this morning to tell you about the collaborative approach taken by Directors of Public and Population Health in Cheshire and Merseyside. My colleague, Dr. Sarah McNulty, who's the DPH at Knowsley Council, actually leads on this piece of work, and unfortunately she couldn't come along this morning. But I'm going to do my best just to tell you a little bit about how we've developed the Cheshire and Mersey framework. And I think more importantly, how we've actually developed a co-investment approach to this work. So next slide, please. Oh, sorry, back slide, sorry. I'm jumping ahead here. I think just to say what you can see on this slide is our vision for to end smoking everywhere for everyone. And it's also very important for the Cheshire and Mersey context to understand that we're a marmot sub-region. So within this work, it's very important for us that we do this in a fair and equitable way. And another big piece of work that we're doing locally is our child poverty work. So again, this is very much about, giving every child a tobacco-free future. Next slide, please. So I'm not going to read all of this data because this is data that you're all familiar with. We know the impact of smoking is really significant. We know the impact on deaths, on disability, but also on the financial impact. So we're very clear that within a local authority and an NHS setting that we're committed to delivering a programme that's going to save lives, is going to improve the quality of life of our residents in Cheshire and Mersey, but is also going to help lift families out of poverty. And as I say, that's why I think it's really important that we have this collaborative approach. And what we've done is we've looked at we've already heard about some of the investment issues, but working together, we've co-invested in a 3-year programme that hopefully is going to kickstart the 2030 smoke-free agenda. So next slide, please. And this slide just summarises that funding. So you can see here that we've invested money collaboratively as Directors of Public Health. We've put an additional 900k into this work, but also our ICB have allocated £3 million to this work. And I think that the important thing to stress here that this is additional money. And again, if we're all aware of the really significant financial challenges that NHS bodies face. So I think for us to get this funding through what's called an inequalities fund in our health and care partnership is a real achievement locally, and we're really pleased to be doing this work going forward. And I think it recognises the importance of trying to invest at scale to enhance the work that we're doing, but also it's a recognition from our NHS colleagues that there's a real return on investment if we can do this work. Next slide, please. Now, many of you will have seen the Empower model, so I'm not going to labour this, but it's the model that we're using locally to drive this work. And there are three key outcomes that we want to achieve, and that's preventing people from taking up smoking, to increase the number of people who are attempting to quit smoking, and to reduce the number of relapses amongst those people who have decided to quit. Next slide, please. And again, you know, that's the outcomes that we're trying to achieve, but this is the model that we want to use to get to those outcomes. I'm not going to read through all of these, but you can see, you know, it's really important that we work across different settings and in different situations. So, you know, we've got education, we've got environment, but we've also added here partnership and advocacy. And that's really important, because what we're trying to do is, you know, like all colleagues on this call, we're trying to change the culture. So we want to engage with communities. We want to take people with us, so that we can, you know, we can end tobacco use. So next slide, please. And then, you know, so our goal is obviously to achieve smoke-free Cheshire and Mersey by 2030. And we'll deliver this through a multi-component programme. So I've already said it's really important that we engage communities and stakeholders, that we increase the population level quit attempts, and in doing this, we're recognising that quitting smoking doesn't just take place in smoking cessation services. So we've got to get that wider reach. We want to reduce illicit tobacco use, again, to maintain that price driver. And also we're going to see that actually data and insight is really important to this. So that's very much part of our programme. So next slide, please. So we're still, we're still in the mobilisation phase. We're in the first year, but we are obviously developing some of this work. And just to go through some of the actions that have already taken place. As a sub-region, we've developed a stop smoking system position statement, and that's very much about recognising the need for better integration between our local place and stop smoking services, which are in most cases well established, and through to our NHS services. But we don't just want to have integrated pathways. We need to make sure that we've actually got the same sort of level of quality and consistency of approach. And we're also, as part of that consistent approach, we're also working to develop an illicit tobacco, to combat, illicit tobacco and vapes through a brand new programme working with our Trading Standards Northwest colleagues and also our local authority and Trading Standards team. Another key element is developing a comprehensive data and digital stop smoking support platform. And that's where we can hopefully understand the smoking impact and outcomes and engage with our smokers directly. Because again, going back to the previous slide, it's about changing culture and we want to take people with us. So the next slide, please. So these next two slides just give you a couple of examples of work that we're doing and we're funding through this collaborative. Firstly, we have a recognisable public-facing brand for our Smokefree programme, and that sits alongside our website, which will act as a one-stop shop for stop smoking support and a central hub for all our future campaigns. So we have Altogether Smokefree, and in Cheshire and Mersey we have other Altogether brands. So it fits into a nice suite of health improvement brands. We're doing this work obviously with an external agency, but we have had lots of support and we've learnt from the brilliant work from the North East, Greater Manchester, London and Yorkshire. And I think, again, what's important is we obviously hope to evaluate this work and to come back and share, our positive and where maybe we haven't done so well, to share our experiences with colleagues. The next slide. So the second piece of work I just want to highlight is that we prioritised as Directors of Public Health and Commissioners of Smoking Cessation Services. We're very much aware, and again, it's been alluded to in the earlier presentation, that we need to develop our workforce. We need to make sure that workforce have the skills, the knowledge and the competencies to be able to deliver quality services. And that's, again, really important, that we want that consistency across NHS and local authority services. We can have additional money, but when we've all got additional money, it's terrible to say, but sometimes it's difficult to spend that money, isn't it? To try and find the workforce, to try and develop the right level of service. So we're currently undertaking a mapping and scoping exercise, and we hope to have those results by March. And again, we'd be very happy to share our experiences with others. So those are just two examples of what we're doing, and I hope that just gives you a flavour of the work that's going on in Cheshire and Mersey. Last slide, just to finish off, just want to really sort of summarise the importance in here is about working collaboratively, about doing things at scale. If we pool our resources, we can have a greater reach, we can have a bigger impact, and we do have a history of doing that in Cheshire and Mersey on a whole range of topics, and I'm sure it'll be exactly the same for Smokefree, that we'll be able to work and achieve more working together. So I'm going to stop there.
Thank you indeed, Margaret. And again, some really helpful insights that I'm sure everybody's taking away. Just a reminder before we do move on to our next speakers, do post your questions in the questions in the chat function. We'll get to those in about 15 to 20 minutes. Excuse me. Right, now we're going to move to another case study, an update on the Yorkshire and Humber workforce development strategy. I'm delighted to welcome Kaye Mann from West Yorkshire Tobacco Control, from the Integrated Care Board. She's Tobacco Control Lead, and Sophia Papadakis, who's the Academic and Health Service Systems Consultant at the National Centre for Smoking Cessation and Training. A warm welcome to you, Kaye and Sophia.
Thank you. Morning, everybody. I'm going to kick us off and then I'll hand over to Sophia shortly, if that's okay. So yeah, excuse me. I want to tell you what we're doing in Yorkshire and Humber, and specifically our workforce strategy. Next slide, please. So across Yorkshire and Humber, we've had a collaborative approach for a number of years now, and we've made huge reductions in smoking prevalence across the patch. But like everywhere, the inequalities still remain, and we've still got a lot of work to do to get us to that 5%. So all our 14 areas, 14 DPHs come together under the Breathe collaboration. And our smoking grant, which we're very grateful for, even though it's caused a lot of work, it's great news, has enabled us to come together even better and benefit from economies of scale, as the lady just before me were just talking about, all the benefits of working together. So across Yorkshire and Humber, we're having mass media. We're using the money, putting the money together, but today I'm going to be talking about the workforce development, what we're working together on, and working with Sophia at the NCSCT in partnership with. Next slide, please. So why workforce development? We've already got great services across Yorkshire and Humber. I don't know if any are in today, but a shout out to those services. We've got excellent tobacco leads, excellent services, but we just want to take it to that next level. There's always room for improvement, and it's vital that we have empowered and skilled and adaptable workforces. Things change. When I was a tobacco advisor many moons ago, we didn't have this technology like this, so lots are changing and different, like medicines, etc. We've got to keep up with the times, and training is never a bad thing, so the more the better. And it is welcomed by our services as well as tobacco leads, commissioners, etc. So we did do a needs assessment before we started all this work, and the want is there. So we have worked in collaboration across the Yorkshire and Humber system with everybody involved to make sure we get this right, and it's something they want and that they're up for as well. So it's not just the smoking advisors we want to train and get to that next level. It's also the commissioners, the service managers, the admin staff. All of that works together to make the world-class services and the world-class staff, basically. So it will involve training for all those people. upskilling that workforce. And we do want personalised interventions. So we know we've got massive inequalities, as most areas have across Yorkshire and Humber. It's very evident. So we want the right help for the right people. So this training will help us to do that as well. Next slide, please. So that's just the vision of the brief. So we want every smoker to get the highest level of expertise, and it's all system led. We all work together to make sure what we deliver is the best possible service. Next slide, please. So our objectives of this strategy: we want to increase the quality and the availability of our services, so making them easily accessible for anybody who's wanting that help, and like I say, it's top-notch quality. So partnering with NCSCT to deliver it, obviously it's all evidence-based training, and like I said, across that workforce. We want culture transformation. So we want a culture of continuous improvement. It's not just a case that, right, they've done the 2-day training, crack on for the rest of your career. There's always improvements to be made, and obviously improvements for this as well. So we want to evaluate and measure the programme effectiveness as we're going along, so we can adapt and just constantly improve what we've got. Next slide, please. So key activities, so as I mentioned, it's not just upskilling our advisors, it's going to be the managers, the commissioners, etc. But in the next stages of the training plan, it's also about that very brief advice, so working with the mental health service, with community groups, etc. It's everybody and anything we can train up to help us basically help people to quit smoking. So we will be, well, the NCSCT will be developing a range of resources, and these will be available for all eventually. So we want to share that learning across everywhere. We're collaborating across the system. As I said, it's not just the stop smoking specialist services. We want everybody to be trained up best they can, and using that targeted approach to reduce inequalities. Next slide, please. As I've already mentioned, it's NCSCT, so it's obviously evidence-based, and we're also taking learning from other areas for this as well. The oversight is with the brief, is the 14 DPHs across our region. Next slide, please. So outcomes and impact, we want a world-class services, we want world-class workforce across Yorkshire and Humber, we want reduced inequalities, obviously, and obviously we want that 5% and under target by 2030. And as I say, we want to share this learning as well with all. Next slide, please. So we do see this as a critical investment, basically. Like we've all got this money, we want to spend it wisely, we want to get the best bang for our buck. And in the words of Scott Crosby, we can either lead or we can follow. And in Yorkshire and Humber, we'd love to lead this and then share it across everywhere. And I'll hand over to Sophia.
Great, thanks, Kaye. Just a very few words on this partnership that we're very excited about. NCST is just embarking on this collaboration with Breathe, Yorkshire and Humber. A little bit about our perspective on the challenges going forward. This slide is titled From Good to Great. Not to be forgotten is the world-class services that local stop smoking services have been providing for a very long period of time. And I heard Margaret say it earlier, we want to continue this work of providing high quality services at scale and make sure in everything that we do not lose focus on the importance of making sure our services are high quality. So we're going to be evolving and really important in that evolution that we stay focused on keeping our work evidence-based, bringing together the wonderful work of regions, local authorities, but also experts that are working in the area of trying to drive down tobacco rates. Earlier this year, John mentioned that we released the 10-year update to the local stop smoking services guidance. It's guidance for commissioners, for service delivery and for monitoring. It's a comprehensive document and a companion document just last week, maximizing the impact of local stop smoking services. These documents are also part of NCSTT's strategy for over the next 5 years to really focusing on overcoming the barriers to accessing support, in particular to priority groups, and maximizing the effectiveness of support by individual tailoring. And we've said it, I think each of the speakers today, our workforce is at the heart of this work. We need to be building competence in our workforce. We've done a great job of making sure our advisors are trained up to the national standard. Well, the national standard needs to go further now. So that's what this work is embarking upon. We're looking at developing new interventions, so new ways of working and delivering service together, building on everyone's collective expertise, new training resources for the groups that Kaye mentioned a moment ago, commissioners, managers of services, leadership in services, but also the practitioners and the entire team around the Stop Smoking support, and new resources, toolkits, et cetera, that will help move this work forward. Next slide, please. Just a few words on our vision, our collective vision with NCSTT and Yorkshire and Humber. Target and tailoring. We're focusing on priority groups with our work. We've got to choose a focus and with respect to the workforce strategy, we're looking at targeting services to priority groups where the need is greatest, but also tailoring interventions to individuals, persons who smoke, really make sure that we can attract them to services and then make sure they have the best possible outcome from those services. So it's all about upscaling our workforce. It really is also, though, about ensuring that everything we know about addressing priority groups, our high needs groups, those groups in which we've already said we've got stubbornly high rates of tobacco use, doing more of what we're doing is not going to be enough. And so we're looking at digesting everything we know about working with these priority groups, these very important priority groups of which we all know well, and embedding the latest evidence. Some of it will be experimentation and some of it will be driven in the latest research. We're working towards best practice for all. So regardless of where you sit in the continuum of needs, that we can offer you a service and provide a workforce who understands how to assess need and tailor and target services. Next slide, please. So the work that we're embarking upon has been designed around 2 work streams. The first is service targeting. And this is really about engaging with priority groups, looking at how we can expand reach. This is a lot to do with process structures, staff training, and how we can adapt services to meet the needs. Work stream 2 is around intervention tailoring. And this is to do with replacing our standard treatment program that has served us so well in making sure nationally we have a clear standard of quality stop smoking service. We're not throwing it out the window, but we are looking at replacing it with behavioral support interventions that meet the needs of individuals, putting the individual at the heart of what we do. And this is going to include specialized training. So if you will, our national stop smoking practitioner training will be updated. We're going to be pilot testing that with our partners at Breathe locally to make sure we get it right. It will be a co-designed process. And in the months and weeks ahead, we're initiating this work so that we can bring something to you next year that is reflective of the important work that needs to be done. A very small note that this work includes, or a particular focus on adapting VBA for non-clinical settings. We've done lots of work over the last couple of years with the NHS and long-term care plan of adapting treatment to fit into clinical settings. There's been a long-standing work with social and primary care health settings, and we need to now look at better partnership and different working models in our non-clinical settings. So that's a little bit about this partnership. We're very excited about the opportunity. Lots of work in front of us, and we look forward to coming back and sharing with you where we've been in a couple of months' time. Thank you.
Excellent. Thank you, Kaye, and thank you, Sophia. I can feel the passion and the excitement coming through. So thank you for that. We've just got one last presenter before we can move to some questions and answers, and I'm delighted to welcome Alison Challenger, who's Director of Public Health at West Sussex County Council, Alison was going to be talking about guidance on using the new tobacco control funding. So a warm welcome to you, Alison.
Morning, thank you very much. I'm also here on behalf of the Association of Directors of Public Health, where we have a policy advisory group for addiction, and we've been really pleased to be able to support the briefing that Ash developed with colleagues in North Yorkshire. Next slide, please. I'll try and race through this because we do need to get to some questions. So the new briefing was developed and published back in March, and we were very pleased to review this, not least because it was a very big input of additional funding that we needed to really learn from one another in terms of what are our opportunities and that we can do with this sort of money. So the paper itself does outline the opportunities around with the proposed legislation and with the additional money. I'm very conscious that different areas have had different amounts, so there will be different solutions that need to be considered there. It does outline the evidence base, and it also brings some of that learning into that briefing in terms of some of the evidence-based activities we can do to max this out. Next slide, please. You will know about a lot of these. Here is listed a lot of the opportunities that come through local authorities. Of course, we also have tobacco dependence treatments, and we also have the baseline funding in the public health grant. And there are probably many more in your local areas. Next slide, please. Quitting behaviours. I'm just conscious there'll be a lot of you on the call that have huge experience and knowledge about all of this. And we do know that most smokers wish they hadn't started and do want to quit. We've really got to scale up the numbers coming through for referral. And at this stage, Verenaclean and e-cigarettes are the most effective quit tools. I think also to consider the type of support we do. So it could be one-to-ones, it could be digital, it could be even groups, which were very popular at the outset in 2000 with the Smoking Kills services. But a return to groups might also be a consideration for your local area. Next slide, please. Okay, so this is just a range of the different activities. We know that smoking cessation alone is not going to bring down smoking prevalence by itself, and we need a comprehensive tobacco control plan for each of our areas that incorporates all of these different activities. I'll move on because I know we're short on time. So some of the key recommendations from the briefing is it's really important to make sure we have got a local strategy and that we've got partnerships that wrap around that to move towards that goal to end smoking. And also making sure that we have got the sufficient investment across the whole system. Skilling up smoking cessation services, and we've had an earlier conversation about workforce, extremely important to make sure that we've got an appropriately skilled workforce with that capacity, and that we are using these hubs as excellence and development across the wider services and the system. And also cross-boundary, so things such as this is communications in particular, and potentially also training. So making sure that we utilise some of those relationships across the wider patch. Next slide, please. So I think the next 3 slides are a series of different recommendations, and this is not an exhaustive list by any means, and you could probably add some of your own to that. But some of the key points around this is making sure that you do have an up-to-date local strategy that prioritises how we get more referrals and quit attempts through, making sure that you've got your networks in place and the tobacco control alliances locally. These can be really influential in terms of that reach across the whole wider tobacco control agenda. Collaborating with NHS partners and ICBs where that is possible to do so, and particularly around smoking cessation, where there are lots of different smoking cessation offers, but making sure that they, where possible, are coordinated so that frontline practitioners do know where all the support is. Very important to share learning, good practice, of course. Next slide, please. I think Hazel's put a comment in the chat there. It's really important to keep tobacco control and smoking cessation high profile all the time, and the mass media campaigns are crucial in doing that, and how we then take those into our regional and local levels to do that. A few other supports, a few other suggestions there, thinking about how we increase the referral pathways through a variety of means, and maxing out that swap to stop programme. Next slide, please. I think all of this will be known to you, but you'll have the presentation afterwards. So I think it's just looking for every potential opportunity we can to increase that referral into services. And the next slide. And these last two slides, this is a slide with all the resources around this proposed legislation and the additional funding. So making sure that we're learning together. And the next slide is generally, I think, around the evidence base around smoking cessation. So that's a quick whiz through, but I'm quite keen to hear what your questions are. Thank you.
Thank you very much indeed, Alison. And we've now got some 7 or 8 minutes left for questions, so we'll take them fairly quickly. And if I could just ask all speakers to be fairly succinct in your answers so that we can get through as much as possible. Right, Margaret, I'm going to come to you first. So just to give you warning, how did you make the case to the ICB and the local authorities to make the joint investment in the Champs Collaborative? How did you do it? We'd all like to know.
If I'm honest, I don't think it was too difficult. I think we're lucky that we've got a director of population health who sits in the ICB. So there's a strong voice for public health within the ICB, and also I think during the formation, the shadow ICB boards, we had lots of good public health representation on the healthcare partnership and population health boards. They've all changed their names slightly over the past year, but there's always been that connection. So I think that it's doing that hard work. It's making those connections, building those relationships.
Yeah, as always, it's about relationships and putting the effort in, isn't it? Kaye, did you want to add anything to that about how you've actually achieved that collaboration?
We've had it for a long time in Yorkshire. It's the Yorkshire way. We work together. We share learning. It's that ethos. So yeah, I think you've got to start it, and then it just grows and grows and grows.
Yeah, thank you. A bit of a question here that seems to come through for the chairman. I didn't think this was part of the plan, but there we are. The question is, how do we keep members engaged? I suppose as a member, I've got a view on this. And of course, there's so many things coming in at the moment. There's devolution, local government reorganisation, all being talked about, changes to fundings, etc. So it is a really crowded space that we're in here. And I can say this because members tend to have short attention spans. They move to the next subject fairly quickly. So I think it is all about, Alison had it for me, which is all about national campaigns, keeping the profile, making sure that we keep talking to local authorities, talking to local members, making the local fit with the national, and I think there's still a lot to do. I think the big challenge is, because of the successes that we've had in terms of stopping smoking and prevention and changes to legislation over the last few months, it may begin to drop down the agenda a bit in terms of people's priorities. So we've got to keep it back up there, and Alison had a lot of those answers. So hopefully that was a good chairman's answer. Right, but let's talk about, let's go to Alison perhaps, and you can talk about how do you think we can maximise the opportunity of the tobacco and vapes bill going through Parliament and the media and the public attention on tobacco? How do you think we can maximise that one out, Alison?
Well, I think it is about looking for every opportunity that we have. So there's understanding what members might need that is different to what we might need in terms of our communication. I think this has got a lot of support, this bill. So I think we have to ride on the back of that support. It's got a lot of public support. It's got a lot of partner support. So there are all open doors here, and we need to sort of put in the legwork, put in the time to actually progress this through. So I think it's just one of those themes. It is the most important health concern that we've got. It makes the most difference of any health behaviour, and I don't think we need to lose sight of that. I think there is a danger with tobacco and vapes that we might do lots and lots of talking about vapes, and there are so many concerns about vapes and young children, quite rightly, but we must never lose sight of smoking. We have to reduce smoking prevalence and make sure that that stays our #1 priority across the system. So a variety of ways, and we have to stand in different places. What would help the councillors? What would help NHS? What would help local government? And it's going to take a lot of work, but it will pay dividends, and we've just got to keep it at the top of the agenda.
I think you're absolutely right, Alison. I think it's a very brave step, and it's noticeable it's been cross-party in the way that it's come forward. But I do think the politicians need public support to keep supporting them in their efforts to do it. So we need to lead that as well. I'm going to come to Margaret and to Kaye now. In areas that we don't have a systems level regional activity, where funding can be pulled, how do you think local authorities can ensure that they do get that bang for their buck for the additional funding to stop smokers, to support smokers to stop? So in areas where there isn't that level of collaboration already, how do they achieve it? So Kaye, shall I come to you first on that?
You can do, thank you. You've just got to start somewhere, and it needs somebody to start it, to start those conversations and to take a lead role. Obviously, people are very busy, so it needs that capacity to be able to lead it and start the conversations in all the different levels of the kind of the meetings it needs to go to get that buy-in. So you need somebody, you need the capacity to drive it forward and then bring everybody along with you, and I would highly recommend it.
Thank you. And every small step takes us on that direction. Now you've got to make that first step. You're absolutely right. And Margaret, any insights from you where we don't have that collaboration in existence already?
I think it's using all your skills and partnership working again, isn't it? Like any topic, how do you, so as Kaye says, you have to start somewhere. You have to bring people along. If you've got peers who can tell a good story of how things have been improved in their area, that's often more, that hits home more than, say, a director of public health or, you know, someone else coming in. But if it's your peers for other local authority officers who've seen the advantage and, you know, they've seen improvements in the place where they work, both in terms of feedback from NHS colleagues and others, that's what helps. It's telling a good story, I think.
Thank you. And then final question, which I'm going to put to you. Now, I think this is coming to Alison, Margaret and Kaye. So obviously, I think you'll say that other regions would benefit from this approach. But what is it that nationally, either ASH or the Local Government Association could be doing to support you to make sure this actually happens? What more support do you need on a national level? Let's come to you first, Alison.
I think nationally we have to keep it high profile and on the agenda, and particularly things like mass campaigns are really, really helpful for us to use locally as well. So just keeping it in the public eye, I suppose, and just following through. I mean, we need confirmation on funding. Of course, that's come out earlier in terms of some of the uncertainties. But I think it's about making sure that the actions of the bill are progressed and that we keep momentum going and we keep the profile high. So that really helps if we get the national element of that coming in first. It helps us deliver at local level in a timely way.
Excellent. Kaye, Margaret, anything more to add to that from either of you?
I think just the other thing to add is just having that updated insight and information, trying to keep one step ahead of any counter arguments that might come to us, so that we're, you know, that we're always equipped to deal with that. So that's always really helpful.
Thank you. And Kaye, last word to you, if you'd like to add to anything.
Thank you. We need the money. We need the money to continue to be able to do all this brilliant work. So if we could get that to continue and like better than year on year, that'd be fantastic.
Excellent. So that's that brought us bang on to the end of our time. So on behalf of everybody, we've had just about 140 people on at one point logged on. So a big thank you for you for coming along. Can I, though, on your behalf, thank Will Anderson, John Waldron, Margaret Jones, Kaye Mann, Sophia Papadakis, Alison Challenger. And for the rest of you, have a very good morning, and let's keep up the fight. Let's keep the momentum going. We're making good progress, but there's still a distance to go. But thank you all, and have